Good evening, you're watching NDTV with me, Rishika Barua. This is the show where we take your questions on the coronavirus. We're joined by a panel of expert doctors who will answer all your questions live over the course of the next half an hour. Dial us on that number flashing on your screens and we'll take all your questions about the coronavirus. Joining me on the broadcast this evening, Dr. Parmesh. He's the Medical Director, Diabetes Center. He's joining us from Bangalore. Dr. Santosh Kumar Singh, Consultant and endocrinologist, joining us from Patna in Bihar. Appreciate you, doctors, for sparing the time to be with us here on NDTV. You know, I want to begin by asking the first question this evening. There has been in the press conference by the Health Ministry just a short while ago, it's been said that over 80% of cases that have been reported are either mild symptoms or no symptoms whatsoever. So positive cases, being asymptomatic is a huge cause of concern. Dr. Parmesh, if I could begin by asking you, the huge worry on asymptomatic patients, how does one deal with them? What would you like to tell our viewers?
See, I think that's been the course in most of the countries, even starting from China, that many patients have been asymptomatic. And that's a good thing to happen, because we have seen only 20% have symptoms and only 5% develop serious symptoms and need hospitalization and ventilation. So that's a good thing that the disease is not serious on all the patients who develop it. And the only precaution that we have to take, because there's so many asymptomatic patients who are there who could spread the disease.
Yes.
We need you have universal precautions of social distancing, hand hygiene, and all these precautions that we have been told again and again on the media.
Right.
If we follow that, I think that should be good enough to prevent the disease.
So I think what you're trying to say is that there's a bit of good and bad in the asymptomatic patients, because it essentially means these are people with higher immunity, with better chance of recovery or self-recovery. But obviously, the downside of that entire story is the fact that these could be carriers who have the potential to infect another person without actually knowing that they are COVID positive. So that's, of course, the bit of story as far as asymptomatic patients is concerned. We'll continue to talk a little more about that, because I know that it's a huge cause of concern. Many viewers have been calling in, but our first caller this evening, Sumit, is on the phone line from Noida. Go ahead.
Hi, this is Sumit from Noida. I have a question. It's regarding, is it safe to take a walk outside, within our society? Since I've been having high blood pressure and walking has been advised to me. It's been quite some time that I've been sitting at home and
Dr. Kumar, we've had, Sumit, appreciate you dialing us with your question. Dr. Kumar, if you'd like to take that on, we've had these questions coming in from viewers in the past, people who are heart patients or have diabetes or high blood pressure who are advised a daily exercise, some form of walking. Is it advisable to go down for a walk, go out for a walk?
The importance is to maintain that 6 feet distance. That's very difficult when you are out with and to maintain that distance. So what we can do is to go for the exercises in our house, and if you have the rooftop, you can go and have a walk over there. So the emphasis should be on minimum contact with the other individuals.
Right, so that's very important. So if you can actually afford to maintain that 6 feet distance, only then, should you perhaps be venturing out, because maintaining social distance, is extremely important. Our next caller, Anvind, is on the phone line from Mumbai. Go ahead.
Hello.
Yes, go ahead.
Yeah, good evening, doctor. Yeah, sir, actually, the question is, is there any, particular food or anything which can, as far as, the thing going around, people are saying that people who have a strong immune system, so the virus doesn't harm them. So is there any particular, nutrient or any food which can boost the immune system?
Dr. Parmesh, would you like to take that on? Very interesting question, because it has been said that those, with a higher immunity can more effectively fight the disease. Some even, don't even show symptoms if they have a very high immunity. That's exactly what we were talking about just a short while ago. How do you build that immunity?
I think it's a very relevant question, and in any disease condition, we always forget the host. Host is one of the important factor, and the immunity of the host will also always decide about the consequence of the disease. And when it comes to immunity, with regards to the viral infections, there are a lot of nutrients which have been shown even in China that patients who consume more vitamin C, zinc, and magnesium and certain kind of foods had better results when it came to the morbidity and mortality of the viral infection. And that being the case, even if you're taking certain foods, maybe home remedies and all that thing, we need to understand improving immunity is one thing, but we should not take the risk of getting exposed to the condition, and always social distancing remaining the main norm, and prevention is always better than cure. It's always good to try to improve the immunity, but we need to be safe and wise.
All right. Our next caller, Neha Saxena, is calling from Indore. Go ahead.
Hello. Good evening, Rishika, and good evening, all the doctors.
Good evening. Go ahead. Ask your question.
Yeah, my question is related to a procedure. What is followed for the patients who have gone through being positive and then turning negative from COVID-19? I mean, there are news wherein in China and South Korea, the patients are getting the infection for the second time. So, like in India, what is being followed? I mean, there is no news on any news channel about what happens after a person tests negative after being positive. Now, after that, what do? They do go back in their house.
Dr. Kumar, would you like to take that on? What after you've been, you've sort of been cured from the disease? There is nothing that tells us that you won't have a relapse. What happens to such patients? Can they still infect other people? Lots of questions regarding that.
Once you are cured, you have majority of the cases, not all, they have adequate antibodies to counteract. And as we all know, these people's serums have been utilized in the treatment of frank COVID patients. So they do develop antibodies and they are protected from that. And moreover, they are part of our herd immunity category. And herd immunity, when we have a number of almost 50% of the population, if they are have contacted that, then we had no further increase in the incidence. So one is that. Second is, if the patient has already got discharged from the hospital and he has one test positive, even after being labeled as cured and off febrile for last 3 days, he is to maintain that 14-day quarantine like others. And moreover, for these reports of South Korea with reactivation, it is equally important to maintain that hygiene and social distancing.
So you have to take all precautions even if you have been cured of the coronavirus, because there's no evidence to suggest that you won't be susceptible to the infection again. Saeed Iqbal is our next caller from Srinagar. Go ahead, ask your question.
Yeah, good evening.
Yes, good evening. Ask your question.
Actually, my question is that I have been to Delhi in the month of February, and I came back in the last week of Feb. But since then, I'm having a dry cough, and that is itching my throat also. First question is that, do I need to take some precautionary measures due to COVID-19? And my second question is that my grandmother is there. She was a TB patient, and she has got the surgery in Delhi only. Now she is back. She's very much healthy, but nowadays she's having the cough and she's having the breath problem. Do we need to consult the doctor for COVID-19, and what are the precautionary measures we should adopt at home? Should we keep the distance from her, or should we behave normally as we have to do?
Dr. Paramesh, after listening to these symptoms, what would you advise, and especially, what would you advise those who are suffering from a cough at this time and have elderly people at home?
Yeah, I think this is a very important and common question, because people get worried in this situation. But looking at this particular case, having had the cough for such a long time after a visit to Delhi, and having no other symptoms of fever, breathlessness, of any other symptoms of viral infection like COVID, I think there is very minimal chance that he has any COVID, and I don't think he needs to go for a COVID test. But he needs to definitely look into other causes for the cough and get himself checked for that. And the same thing also applies for his grandmother. I think you should also get your grandmother checked for the reason for the cough. But I don't think there is any worry for COVID in your case or your mother's grandmother's case, because the other symptoms are not there, and it would have flared up by now over such a long period.
All right, so that's in fact a typical list of symptoms as well that we're putting out on our screens.
Rishika,
Fever, dry cough, fatigue are among the others.
Somebody has come from abroad,
yes,
and he is having that respiratory symptoms. And he or she should be tested for COVID, irrespective if he or she is having fever or not.
Right.
The very presence of respiratory symptoms, cough and breathlessness, they are indicators, and it has been recommended to go for the COVID test if you have come from abroad.
All right. So if you've traveled abroad, but in this case, Mr. Iqbal had a travel history to Delhi, but obviously if the symptoms persist, you should definitely consult a doctor, and perhaps get yourself tested. Our next caller, Rohit, is from the phone line from Chennai. Go ahead.
Yeah, hi, all the doctors there. Since we know that the asymptomatic carriers are a big problem in the country right now, so my question is, how long do these asymptomatic people remain asymptomatic? Right. Is there any chance that they never show these symptoms, or at some point they do?
All right, very interesting question. Dr. Kumar, you were addressing these concerns earlier as well. Would you like to take it on? Do asymptomatic patients never show any symptoms? Do they automatically recover because of their high immunity? How does it play out in case of asymptomatic patients?
The usual infectivity of these people is to the tune of 10 days. And it can vary according to the whole spectrum of the disease. As you see in symptomatic patients, it goes from 6 to 41 days. Average is 2 weeks. But the infectivity part is before being symptomatic, the previous 3 days. And for that, it has been said that you quarantine for 14 days, you are there for social distancing in a proper way for 14 days. So that is the usual period.
Right.
But problem is, if you have reports about the positivity, the fecal positivity, they can be there up to 39 days. So these people, on an average, 40 days comes into mind where we need to be cautious with all these category of patients. Otherwise,
right. But if I could bring in Dr. Parmesh and ask a counter question here. Dr. Parmesh, we've seen that the typical quarantine period, in different parts of the country is 14 days. However, in Kerala, we've seen that the quarantine period is 28 days. And it has been shown that, there are certain cases, people who've tested positive after returning from Dubai, 3 weeks later as well. Dr. Parmesh, is that a cause of concern? Should the number of days that one is in quarantine for perhaps be increased to err on the side of caution?
I think this is a new disease and we are all learning. And what we have learned from the other countries is the median duration of symptoms developing is 5 days. And the maximum duration of developing symptoms has been about 11 to 14 days.
Right.
By 14 days, almost 97% of the patients have developed symptoms. We still have the 3% of patients whom we could miss out by 14-day quarantine. And if you are able to quarantine by logistic reasons, if you are able to quarantine for a longer period, it's better.
All right. So the longer the quarantine period, the better, of course. So Sudhakar is calling us from Bengaluru. Go ahead.
Yeah, good evening, Dr. Parmesh. This is Sudhakaran from Bangalore.
Good evening.
Can you hear you?
Yes, we can hear you. Go ahead, sir. Ask your question.
I am a hereditary diabetic patient last 15 years and having trivolips 2 mg every day, morning 1 and evening. From March 18th, I am staying at home. My wife is also a asthma patient. And do I need to take any precautions? There are Bisleri water delivery guys comes alternative day.
All right.
And milk delivery every day. Vegetable from Big Basket every day.
All
mostly
right.
every day.
So you're taking all precautions. Do you have a question, sir?
Should I take any extra precautions other than...
Dr. Parmesh, would you like to take that on? Any extra precautions for diabetes patients? You're a diabetes specialist?
Yeah, I think diabetic patients are at a higher risk of developing complications and a higher mortality rate.
Right.
That being the case, they need to practice the social distancing even more carefully. And the precautions remain the same again for everybody.
Right.
But it has to be followed more strictly for a patient with diabetes, hypertension, smokers, and all those patients who are obese. All of them have a higher risk of developing this disease.
Right.
Even patients with heart disease are known to develop this disease and develop more complications. So all these patients who are more susceptible need to be more careful and follow the precautions strictly.
All right. Our next caller, Lata, is calling from Mumbai. Go ahead.
Okay. My question is, in India, we have this problem of people pulling the mask down and spitting. And when they're handling cash, what they do is they touch the tip of the tongue and then they count the notes.
Yes.
This being highly infectious, I just want the doctor's opinion that these two things will result in the spread of the disease. If yes, then I would request the media to increase the awareness about this thing, because spitting is a big problem in India.
Right.
So
Dr. Kumar, I think there's also been guidelines that have been issued that it's a punishable offence. You will be fined if you're caught spitting in a public place. So that's been put in place by the government. But Dr. Kumar, what would you advise people who are out there in the open, especially when it comes to dealing with currency notes? I think that's a big cause of concern.
We should be very clear that the third modality by the aerosol spread, it's very, even talking and spitting, some states have even banned the use of chewable tobacco. And
yes.
It is very important from diabetic point of view also that you need to avoid tobacco in any form. Spitting is very important to be desisted from. She has answered herself. It is very important to make the awareness that we should avoid spitting in the open spaces.
Right.
Main is just to avoid the spread of infections, what we are doing with social distancing. I just would like to add what Dr. Paramesh said
yes.
About the diabetics. You
yes.
should be very assured that they are not at increased risk of contracting COVID. Once they develop it, they have a poor prognosis. So that is very important and very assuring for the diabetic patients. Okay. So my previous caller, he should not change anything. He should continue with his personal hygiene and social distancing.
So that's very important because if you don't get the disease, then you're safe. But if you do get the disease, if you contract the infection, God forbid, then the prognosis, like Dr. Singh is saying, could actually be a lot worse. Appreciate you clarifying for that, clarifying that for us, Doctor. Our next caller, Siddhappa Swami, is dialing in from Bengaluru. Go ahead.
Good evening.
Good evening, Dr. Go ahead, ask your question.
Evening.
Good evening. Okay. Hello.
Yes, go ahead, sir. Ask your question.
Dr. Babu, good evening.
Good evening.
Hello. My question is to Dr. Paramesh. Yeah. See, I am diabetic for the past 20 years, and I'm being a caller. I'm being a senior citizen. And do you require distancing among people in the house?
All right. Would you like to take that on? Dr. Parmesh, what about social distancing at home?
I think if all of the people at home are following the norms of social distancing, I don't think there is any need for distancing to be practiced at home. But if you are an elderly person and if you are youngsters are going out and coming back, I think you need to be a little careful with that, especially if any one of them develop any symptoms. Otherwise, there are no guidelines on having a distancing within the home individuals.
Yes. All right. So you needn't maintain social distance within the family members living in a house as long as everyone is following the same practices. But however, if somebody is exposed or is a frontline worker, then perhaps, you would advise, doctor, that social distancing should be maintained. I have an allied question, Dr. Kumar, if I could bring you in. What about, the family members of those people who are working on the front lines, whether it's health workers, whether it's people working in law enforcement, whether it's people working in essential services, even journalists, for instance, what would you recommend to their families?
It's very important if you are coming in contact with a health worker, or if you are coming to a direct person who has contracted COVID. It's important. At least ICMR has given guidelines for the hydroxychloroquine prophylaxis. So it should be there, and maintaining the personal protection is paramount for everyone.
All right. So maintain
There's
personal protection. But what about families? Should they stay away from families?
Family members, I'm talking about. If you are, because he is one of you,
right,
who is coming in contact with others.
Yes. So perhaps maintaining social distance would be the safer bet. If you are coming in contact
with a healthcare worker, definitely you have to be cautious from that.
All right. Anurag, our next caller, is on the phone line from Surat. Go ahead.
Yeah, good evening, ma'am. I'm Anurag. I am calling from Surat. I have two questions.
Yes.
One is, what is the status of the plasma therapy trials that is going on in Kerala, Delhi, and Gujarat? I think now they have started.
Okay.
And second is there are reports that rumors rather that Israel has come up with a medicine to cure COVID, and it is 100% successful. Is there any information on that?
All right. Dr. Paramesh, would you like to take on the question on plasma therapy and explain it to our viewers?
I think it's not just the 3 states, even Karnataka and many other states have now started, have accepted this, but it has been accepted as a trial and they found benefit, but it has not become an universal treatment guideline.
Right.
See, in an emergency situation like this, we have to adopt newer strategies to save patients who are sick and going to die anyway. And this plasma therapy has definitely shown good results. The Israeli technology that you are talking about is placental stem cells, which has been tried only in 7 patients so far and has given very good results in serious patients.
Right.
It's yet to come into the general practice yet. I think if it's good and encouraging, it will come out soon.
All right. What about medication? Dr. Singh, would you like to add anything on medication that you'd like to advise viewers about use or abuse of medication?
Medications in mild cases, moderate cases, there are trials even in severe cases for hydroxychloroquine.
Right.
Otherwise, the majority of the drugs which we are using, it is mainly for the severe and critically ill patients.
Right.
Be it remdesivir or lopinavir or even interleukin-1 beta. Now, if you have a cytokine storm, where you have increased IL-6, if it is more, then you for the IL-6 antagonist. So those majority of those agents which are being used, it is mainly for severe infections. Mild, moderate, severe, hydroxychloroquine is the drug which is being tried worldwide in majority of the patients.
I'm afraid I'm completely out of time, but appreciate you, Dr. Paramesh and Dr. Santosh Singh, for joining us on the broadcast, for taking out the time to answer the questions that you have. Thank you so much. A big thank you to all the callers who've dialed in as well. That's all we have time for on the show this evening. Thank you for watching.